Hello, and welcome to our Technology and Youth Mental Health series. I'm Yuki Kotani from the Child Mind Institute, and today we're discussing the critical intersection of technology and ethics and youth mental health. So, at the Child Mind Institute, we believe that we need more ecological data. So, data that goes beyond surveys and the four walls of research labs to represent actual interactions between people and the technologies in their daily lives. Access to these types of data presents both tremendous opportunity but also significant ethical challenges, particularly concerning equitable outcomes for diverse patient populations. So I'm really excited to be joined by Becca Brendel, director of the Harvard Medical School Center for Bioethics. Becca has direct experience with these ethical and equity challenges. So welcome, Becca. Thank you for being here today. Becca, I know you work on medical ethics, and what we're looking at here is just a really narrow slice of the ethical questions you probably tackle in your day to day work life. But the proliferation of data to drive better research is really relevant across the entire healthcare sector. What are maybe one or two of the top ethical concerns you want healthcare researchers to be mindful of as they expand into collecting and using data from newer digital sources and technologies?
Wow. What a question, Yuki. And we could spend our time together entirely just defining the question, and then we could spend another day, 24 hours straight, just honing it. But let me say that, we're in an era where we have so much promise from the kinds of data that we can get. We have access to data, to large data sets, to data, metadata, experience data, and and all of that, right, has the ability to really help us characterize, develop, and deliver mental health interventions, both at the time that the user is interacting, for example, with technology, but also to look for screening and to improve mental health and to improve access to all who are in need through predictive models. So that's the promise, but there's also a huge responsibility in that. When we have access to all of this possibility, we need to make sure that it's not just the people who live in urban centers and have broadband internet access who are getting treatment, but that we are thinking about the mental health as something that's integrally part of health across the lifespan for every person, regardless of where they live, and regardless of what kind of insurance or other access to care they might have in their hometown. So I think really the balance between both the promise on the one hand and the responsibility on the other is really a nice place ethically to start our conversation about what we need to think about in conducting this research and where we might need to go.
Yeah, no, I think that makes a lot of sense. What are your sort of thoughts specifically around collection of data from youth, right? They're a very vulnerable population. Are there sort of additional safeguards that need to be considered when collecting data from youth and applying it to youth and youth mental health?
Right. So the problem was already big enough, right? And now we're talking about youth who we've historically considered a vulnerable population in need of added protection for all kinds of research for very obvious reasons, right? Beginning with how well youth can really understand and appreciate what the data is being used for, as well as the potential risks and benefits to them individually and to society. On the other hand, right, if we go back to the paradigm we were talking about, while there are these risks, there's also this real need for youth mental health resources now. And so, in thinking about where we go, I think it would be a mistake ethically, and most of us do, to say that the risks are so great that we're just not going to do this research because we know that our young people are back out in life after a really crushing pandemic that broke down their social structures, their support structures, and that our youth are doing what their parents need to learn from them and talking about their mental health and expressing concern and trying to come up with solutions. So it's really going to be, again, this balance that both protects young people and how their data is used, but is not so restrictive that it leads to the inability to do much needed research that can really advance the cause.
Yeah, no, definitely. And right, it's that sort of like balance as you just mentioned of um, the data that we actually need to get while also protecting our youth. So, kind of building on that, especially in context to youth mental health, is the issue of privacy, especially when it comes to data from social media. So, how that data is used in researching about youth mental health and thinking about patient privacy, youth privacy. Can you share some of your thoughts on like some of the ethical trade-offs in this area? And second is, how should researchers balance the need for consent
Mhm.
against the need to advance knowledge?
Right. So, when we think about research, the backbone of the ethics of research is about consent, right? So for youth, if it's minimal risk research or relatively low intervention, usually we go to their parents. As they get older, we think about assent or shared decision making, um, and and that can work pretty well. The other principle that we used for a long time that's no longer really possible is this idea of anonymizing data, right? So that if the data is scrubbed or the info, you can't be identified from your data, which works fine 25 years ago. When journals weren't electronically published and people could change names or identifiers in print, that was okay. But the second, we have consent, and then we have protection through anonymization. And we know that in the current era of big data, that's not really possible, right? If we promise people, well, yes, we could take your name off it, but there's so many possibilities of re-identification. And in some situations, our data science has gotten so advanced that we can actually want to re-identify because we find out that there could be specific potential or actual benefit to somebody who's participated in research, right? So with those two concepts, both present but a little bit weakened in terms of the protections we felt certain about. Certainly, consent matters, right? You can't take my data without telling me about it. If I'm interacting with you now and someone's looking at my eye movements and my heart rate and my skin resistance for empathy, we're having a great time and I feel good about all that, but I should know about it if somebody's doing that, right? So I think consent really does matter. And it does matter that there is somebody of mature decision making ability to help with that and make sure that youth are protected. But beyond that, right, consent may also be limiting. And there also may be certain features of needing to get data, especially from persons who belongs to groups that have been historically excluded or mistreated, that's necessary to advance health equity. And so while understanding that data may be used is important, actually requiring the kind of consent that we require when we do something to your body or try a new medical treatment probably goes too far and would be stifling on the kind of data that we need. So really in that same piece, the responsibility and also the promise, and then making sure for certain that data is not used in overtly identifiable ways that could be harmful to individuals or groups of individuals.
Yeah, no, and that's really interesting, especially right now, right? I think there's a bigger push from big tech to share their data with research. And so there's a couple of different organizations that are sort of working towards that. And so how do you kind of ensure, right? The big tech has their sort of their own objective and the data that they need to collect to, optimize their product while also helping to move research forward so that we're able to build safe and effective products for our youth. So on just adding to that, like, right, so there's just so much like rapid advancement in digital technology. Um, do you think our current ethical frameworks are sort of keeping pace with the rapid advancement of the space? Do you see sort of areas where there is a need for new guidelines or policies?
Well, I think the risk is being complacent and thinking that our old safeguards for our core values are going to work in the age of big data, not to mention AI and subsequent technological advances. But it doesn't mean that the underlying principles or ideas or ethical commitments go away. We still care, for example, about respecting people and making sure we have their permission to do things or take things from them, including their data. Um, And also responsibility that people aren't harmed by it, and that we're taking safeguards to make sure that doesn't happen, especially to our young people and others who could really be subject to significant harm. When we're talking about online data, for sure, we know that online discovery and sharing of data can be really problematic and troubling for kids. So that's the space that we're in. Not abandon our ethics, but come up with new ways of making sure that we can really embody our ethical commitments to both doing good research, making sure we're doing it safely, and making sure that we do it in a way that's respectful of those who are participating. That may be really different than just getting consent on a form, though, right? So I think you and I both share this idea that one of the ways that we can think about respect in terms of using data is advancing equity and making sure that all persons have access to the fruits of the labor, so to speak, in the research and in the data collection. And I think that might be a different kind of paradigm that we're thinking about when we start thinking about big data and population level health prevention and interventions, that we're talking about the kinds of commitments we make to each other as citizens, as opposed to very specific safeguards that are, of course, important. I'm not suggesting we should not have privacy or safety protections, but we're talking about different kinds of ways, really promising, exciting ways of recognizing our ethical commitments.
Yeah, and going back to what you mentioned earlier, like it really truly is this balance and like a constant balancing act. So sort of switching gears into more like the real world application in a clinical setting. So, so much is available today on, as we mentioned, on people's behavior, whether it's based on surveys or passive data collection, that could be used to inform clinical treatments if a clinician had access to it. And here at the Child Mind Institute, we're building products to do this in a really targeted way. So, are there sort of particular concerns that come to the top of your mind when you're thinking about putting data from young people, from youth, into the hands of clinical providers?
Well, certainly there has to be an understanding of what data is going to be used, with a primary focus on the well-being and safety of kids, right? Who are engaged in the clinical treatment. So I think that really requires a conversation both with young people and with adults in their lives or others who may have a broader view that life is not entirely lived through social media and online, but that there is some value, perhaps, especially later on in life. We might have different ideas about our privacy. So, um, the very basic data, many years ago, we started thinking about how could we use some of this data from the user interface to advance treatment. Was being done on the West Coast, as you know, thinking about metadata on cell phones and the treatment of depression and psychosis, right? So that if a physician had access to that data and knew if you were leaving your house or not, it might be a predictor of relapse or worsening symptoms, or it could be evidence that treatment isn't working or is working, right? So I say that to say it's not that this data isn't useful. It's really about establishing the parameters in how we're using it, letting people know and reminding them of what their clinicians have access to, and not conditioning treatment on access to that data, because different people have different tolerances and different preferences about just exactly how much is measured. Some people love their Aura rings and their biofeedback and their watches, and other people are very happy having the small fluctuations in their heart rate and blood pressure be a mystery that they don't know about. So I think we have to think about different kinds of preferences, but also, again, really what the trade-offs are. And as a very basic requirement, that we're taking every step possible to de-identify data and to make sure that it's safely stored in respect of people and their privacy.
Yeah, and I think that's the big part is how do you de-identify, yet using the data to create sort of a targeted, like personalized, like treatment plan, or trying to collect data right, we're doing a lot of work around like ecological momentary assessments and like collecting data in between treatment sessions or appointments. So
Well,
I
but
think,
we always kept medical records, right? So
mhm,
we know how to. It's a little bit, we felt okay about the two lock rule for
yes.
protected health information, right? So we need to have things that are akin to that and have reasonable expectations, right, about what that means. So we have to safeguard the very best we can, but also living in the digital age means that even the most heavily safeguarded material and data can be subject to illicit access. And so, what does that mean? And what are the ways, what are the mitigation strategies to store data in a way that every fail-safe, if every fail-safe failed, how would we still be doing our very best to protect kids?
Yeah, no, it's right. It's just such a complex issue right now, and I really appreciate you sort of sharing your insights today. I think there's a lot to think about as we sort of navigate this ethical landscape of digital data in healthcare, whether it's used in research or in clinical practice. Um, so just to summarize, you provide us sort of a perspective on balancing privacy with the need to advance knowledge, and the the bigger question around and ethical concerns around integrating this real world data into clinical care, and either in both situations is so invaluable. So we do need to keep moving that forward, but keeping sort of these guidelines and policies in place, and also making sure that we iterate, that we're keeping up with the very fast paced nature of digital technologies. Um, it's clear that these discussions are also just not theoretical, right? And so we just mentioned really briefly about also the real world implications. And so I think the takeaway that I want viewers to get is that both researchers and practitioners can take away some of these insights and really implement it into their own work as well, and think about some of the ethical considerations when they're putting their study protocols together. So, Becca, do you have any final thoughts that you want to share with our viewers?
Well, that was a great summary, Yuki. And I think what I would want people to go away with is not to be afraid to use it, collect data and use data in a way that can advance the treatment of individuals and our public mental health and health more broadly. It's a huge resource that we have to be able to collect this data and use it for good. At the same time, we have to remember our ethical commitments to the well-being of people, certainly to people who deserve and need our protections, like youth, and also within the context of professions, as psychiatrists and physicians, our primary responsibility to our patients, and that very core fiduciary responsibility and ethical responsibility. So I bring that up all to say that we need to keep doing the work, keep thinking about how we can advance the protections for data, how do we protect people in the digital era, but not let it get in the way of our doing really important work we know we need to do in advancing mental health for everyone in our nation and then globally and beyond. So thank you so much for this wonderful conversation, Yuki.
Thank you so much for your time and really sharing your expertise. I'm really looking forward to seeing more of your work, and what you're continuing to do at the Bioethics Center. And I think this is just such a really important conversation. So I hope that we can continue this conversation in the future.
I really look forward to it. Thanks.
Thank you so much.